I'd like to call this meeting to order. Let's go around and identify ourselves for the record. Chris, we'll start with you. Identify yourself.
John Weddleton.
Dick Trainey.
Suzanne LeGrand.
Felix Rivera.
Pete Peterson.
From the administration.
Trina Penny, Director of Employee Benefits.
Ron Haddon, Person Director. City Council.
Mr. Abbott.
Mike Abbott, City Manager.
Okay. We're here to discuss about AM 564 2017 VERA. So, administration.
I will make a couple of brief remarks. So the mayor, in and out, he might want to say this stuff instead, but since he wandered back out, I will. Mayor's challenged us to figure out ways to turn the curve in the expenses associated with the health care we provide for our employees. The program that over which we have the most control is our self-insurance program, which covers about 1,900 of our active employees, and which includes about 350 retirees. So about 1,500 employees and another 350 retirees. That all told, that group of 1,900 folks and the total employee and employer contributions to that cost the city about $54 million a year. So when that goes up by 10%, using a sort of a typical growth rate for a medical inflation rate, that's $5 million. And that is largely paid by the employer, not the employee, and that is a huge challenge for us to manage in annual budgeting. So the mayor challenged us to come up with some options and ideas for turning that curve, or bending that curve south, ideally to reduce the total expense, but at least to slow its growth. And towards that end, we became aware of a program like a health clinic for employees. We saw that the school district was ahead of us by close to a year in searching for similar solutions to similar problems. They'd identified this solution and had taken, done a lot of the trail breaking required for any government entity to consider something like this. We saw what they had done. It appeared to be very attractive in terms of the opportunity for short-term and long-term savings. And so we began working with the school district and their chosen provider, and were able to essentially piggyback on the contract that the school district was authorized to sign several months ago. In the meantime, we've been in negotiations with VERA and in consultation with the school district, and the result of that is the recommendation of award that you see before you. So unless there's any questions sort of on the big picture stuff, I'll turn it over to Juna, and she can walk you through some of the more specific information on the contract.
Before we begin, I just want to recognize the mayor's joined us. To assembly members, we're going to be ending this meeting at 2:15, so make sure you get in line to ask your questions because it's a short meeting. Go ahead, ma'am.
Thank you. So our agenda today is to talk about VERA Whole Health in the Anchorage School District, the services that will be offered, the benefit to our employees, a success story, and I'll tell you now, unfortunately, our internet is very, very slow, and so I'm not going to be able to show you the video clip that I was hoping to. But there is a link in the PowerPoint you have. Estimated costs for startup year 1, 2, and 3, employee incentives, and anticipated savings. So as Mike mentioned, we have followed the Anchorage School District in a cooperative purchase agreement or arrangement. We have relied on their process. We feel that they went through a competitive bid process. They awarded a contract to VERA to provide clinical services and management services of an on-site VERA-site clinic to the Anchorage School District employees who are on the ASD health plan. If you do have any specific questions for ASD, we do have a couple folks in the audience who might be able to answer some specific questions about their particular arrangement. So the VERA model, they're built on the belief that healthcare should be more than recovering from an illness, an injury, a sickness, and should be more about staying healthy in the first place. They believe in convenience and flexibility. Their goal is no wait times for patients with appointments. They have convenient locations, flexible hours. They'll be open 40 to 50 hours per week, and there'll be easy access for our members and with same or next day appointments. The Anchorage School District clinic is on 36th in Midtown. We anticipate a clinic in East Anchorage. About 45% of our population lives in 99504, 99507, and 99577. So east side is kind of where we're looking, and that mimics the Anchorage School District employees' locations as well, where they live. Roughly 70% of our adult, and I think I've told you this before, about 70% of our adult populations, employees and spouses, haven't had a wellness visit and didn't have a wellness visit in 2016. VERA's model is to get them in, to spend time with the provider, not 5 to 10 minutes like they get today, but more like 45 minutes to 60 minutes with the provider. VERA is, once they get in, they will, VERA will focus on wellness and disease management. Their providers will be aware of some of the tools and resources that the municipality has through our third-party administrator, VERA, and the new Livongo for diabetes that we just launched August 1st, which is a management tool for those folks in our health plan who have been diagnosed as with diabetes. In addition, they will have health coaching. They know that it works. It's about taking proactive steps to mitigate risk factors or to avoid risks altogether. It's more than just an annual exam. It's 8 to 12 weeks of a coaching program to identify behaviors and habits that negatively impact our health. VERA prides themselves on improved member experience with the providers, their health coach, and they want to be able to help the member right away. The services to be offered, and I have a separate sheet if you'd like to see those, but at a high level, those things that will be offered are primary and preventive care, an annual comprehensive visit, episodic care, acute care, chronic condition care, and disease management, pediatrics above the age of 3, and health and lifestyle coaching. There'll be a formulary and laboratory services, so provider dispensed medications, labs, immunizations, and injections. Wellness services, so the health risk assessment, biometric screenings, whole health council co-facilitation, group coaching, lunch and learns, health fairs, etc. The management services are all those services that are needed to operate a clinic. They'll also be providing information for us via reporting on care coordination, referral management, disease management, those types of things. So the benefit for our employees is, first of all, the eligible employees to participate with VERA are those who are enrolled on the MOA health plan, including their dependents. There'll be no charge for services at the clinic, except for a nominal fee for those who are on a qualifying high deductible health plan, and that's because of federal regulations that you have to have a fair market value for those services. And that would only apply for acute care because preventive care is covered on all of our plans. There'll be 50 to 75 generic prescriptions and antibiotics that can be dispensed at the clinic, as well as some in-clinic lab tests.
As we start this, we send a copy of that to all city employees so they know what pharmaceuticals 75 they can get.
We can do that, yes.
If you would, please.
Absolutely.
Thank you, ma'am. Let the minutes reflect, too, that Amy Dabowski's joined us on the phone. If you want to continue, ma'am.
Also, in addition to specific clinical services, VERA has an electronic medical record that links to other VERA clinics. So our employees will be able to use other clinics that are operated by VERA, for instance, the Anchorage School District. If you're down in Portland, there's also a clinic there. There are 7 other VERA clinics in the Pacific Northwest that if you're there, you can utilize their services at those clinics. And you'll have that, the providers will have that linkage to know what your patient history is. In addition, there is a patient portal that employees and members will be able to see their history and be able to know, they can view their history, they can request appointments and communicate with the VERA providers. Again, as I mentioned earlier, there will be improved accessibility, there'll be same day or next day appointments, and included in some of the services are sports physicals and CDL exams. And unfortunately, here's the link that doesn't work. But just to let you know, the city of Kirkland is kind of the shining star in the VERA network, if you will. They saw a 35% gross reduction in claims and roughly 15% net savings in 1 year. Seattle Children's Hospital, which is virtually the same size as the MOA, saved over $5 million in 3 years of providing services through VERA. So the estimated costs, I've provided these in your packet. And just to note, initially, these costs don't include the incentive for employees, and we'll talk about that on the next slide. So as you can see, we can just kind of go very quickly through the top. For the estimated startup costs for total are $1.8 million, and that includes a $450,000 service fund that's due at signing. In 2017, we will see some of the startup costs, probably 10% or so. They tell us, VERA says that the majority of the startup costs we're going to see in the 2 months prior to the clinic opening, and right now we're looking at no later than March, so it could be February, but it could be March as well. So in 2017, we'll see about $590,000 that will come out of the 2017 startup costs, and then in 2018, once they start seeing patients, we'll pay an admin fee of $17 per participant per month, and at 5,200 is a little over $1 million, and we'll have the estimated pass-through lab and prescription and pass-through operating costs for a total of about $4.2 million. In years 2 and 3 is about $3 million a year. So for a total cost for the 3 years with startup and the annual fees that we see, it'll be about $10.8 million. Okay, employee incentives, as I mentioned, the employee incentives aren't included in those startup costs or in the annual costs. VERA tells us that there's a couple of things that are very, very important in getting folks to utilize the clinic. And obviously, if folks don't utilize it, we won't be successful. So it's very, very important that we get people through the door. Once we get them through the door, VERA will provide them with an excellent customer service and patient experience, and they'll then tell their families and get our members to go to the clinic. So again, one of the incentives is that there'll be no charge for the services provided at the clinic. And again, there is, for those who are on a qualifying high deductible health plan, because of federal regulation, there will be a nominal fee. So the other thing that they suggest is that we provide a monetary incentive for employees to utilize the clinic when they complete 4 steps. And those 4 steps are a biometric screening, a health risk assessment, a provider visit, and then introduction to health coaching. Like the Anchorage School District, we're contemplating $200 per employee to utilize. Once they complete these 4 steps, then they'll receive $200. We're still working out the actual operations of how exactly that will happen. But if we assume 70% participation of our current population, it's about $276,000 a year. And we would need to do that annually to incentivize them to continue using the clinic. Just as an example, the city of Kirkland, their incentive was $600 that went into a health reimbursement arrangement or voluntary employee benefit arrangement, and they had a 90% participation. So that is definitely their success and shining star.
Quick one.
I know, I've got some others ahead of you. I'll put you on the list, if you don't mind.
Had me too.
Okay, I figure I will. Once you finish up, then I'm gonna go to Chris first.
Okay. The next slide are the estimated costs. And I apologize, it's kind of small. That's why I printed it a little bit larger, full screen on your handout, so you would be able to see that. Excuse me. So we provided VERA, or our consultant provided VERA with some claims experience previously, and they looked at our claims experience and feel that these are the cost savings based on the services that they will provide, and based on the services that they provide, these are the savings that we will see specifically from what our patients are receiving services for today. And ultimately, you can see that the cumulative net savings over the 3 years of the initial term of the contract are $10.9 million. So the net savings.
Okay, we got
And I'm
some
sure you
questions
wanna-
for you.
Oh, absolutely.
Chris, you're first.
Okay, I'll try to be quick. I have just a short list. First,
Page
what
one,
happens
page
to
two.
members of our health plan who are not in the Northwest? Does this impact their coverage in other locations at all?
So the retirees, for instance,
Or travelers, vacationers, people who are outside of VERA's region?
they would still have access through to healthcare through Premier Blue Cross Blue Shield of Alaska,
Okay.
because this is in addition to, this doesn't substitute for Premier.
Yep. Then this one's a personal question. I have other healthcare. Will I be able to use this clinic?
You're in the muni plan, are you buying insurance from us?
No.
No.
I have other healthcare.
So you opted out?
Yeah.
Yeah, okay, then
Thank
you
you.
can.
Then the incentive costs are outside of the budget that's proposed.
Yes, that would be funded separately.
And finally, when you say net savings, do you mean 10 million net savings after you've subtracted the $10 million, or is it that we've invested, or is this really net savings over expenses plus the 10 million that we're spending?
This is net.
So it's okay.
Is that all, sir?
Yep.
Okay. John?
Well, I had a longer list. Maybe I'll trim it a bit, but it's just on the employee incentive. I didn't see it in the, is that in this cost page here?
It's separate.
No, it's separate.
No.
It's separate, so where's that come
We
from?
have not locked into that.
Trying to figure out what the rate will be.
We know that an incentive, I don't want to say is required, but is necessary to get the employee participation that we want to see. That's based on what VERA and other Primera and our consultants have all told us. So there'll have to be something. 200 is, the school district has done that, has identified that number. That's our likely target as well.
John?
That's okay, thanks.
Okay. Pete?
Thank you, Mr. Chairman. So, yeah, I'm looking at the $200 fee myself as well. And so, we're providing that fee to sort of give them an incentive to switch physicians, because many people might be used to going to the same doctor for numerous years. And so they build up a relationship with that physician. And so to get them to switch, we have to give them a couple $100. Is that the deal?
That's the theory.
That is to get those who don't have a primary care physician, to get them in to see someone, to get them into the clinic.
As Juna said, we have a high percentage of our people that didn't get sort of a physical, sort of routine visit last year.
But Kirkland paid $600, and we're very, very successful in getting their people to do that.
Right, but remember, they didn't make it directly to people's compensation line. They contributed it through like some sort of a health benefit,
A health
right?
reimbursement arrangement,
I see.
for
So,
voluntary employees.
so it may not have actually costed $600 at the time. If an employee doesn't take advantage of it, it may not be spent, so to speak.
Okay.
So we're proposing something less in terms of the dollar amount, but more likely to be utilized, and frankly, much simpler to organize and to implement.
All right, great. Thank you.
Felix, sir.
Thank you, Mr. Chair. So 2 questions. First, what was the percentage of folks in Kirkland who, before VERA and after VERA, that got a yearly wellness check-in? Did it go up, and what was that number?
I don't know what the number is, but one would assume if they had 90% participation, that it did go up. But I can find that. I can try to find that out for you if you'd like.
It would be helpful. And then second, just to clarify some numbers. So the AM that was sent to us for the July 25th meeting, or sent to us on July 25th, had in here estimated cost savings of 11.28, and this now says 10.9. Is there some difference there?
Yes, and I can explain that.
Great.
So I noticed the same thing. When I talked with VERA and asked them about the difference, the original cost savings was from a return on investment analysis that was done about I believe it was in March of 2016. March of 2017. Since that time, they have they've sharpened their pencil, and it's mostly due to the more increased cost of real estate and the tenant improvements that they saw while they were investigating places for the Anchorage School District. So they wanted to provide a more realistic number.
And just one quick
Go ahead,
follow-up.
sir.
Do we expect that number to change for any reason?
Well, keep in mind that these are all estimates based on usage and utilization, so even the costs are estimated as closely as they can, and they base them on groups our size and clinics that they recommend for us. So the startup cost could be a little bit different, as could the savings. They could be more, they could be less. But that's with their information that they have and their history, that's their best estimate.
Thank you, Mr. Chair.
Mr.
And
France.
we are not likely to budget for all of this savings. This is, I'm not trying to be pejorative here, but this is what the vendor tells us we should expect in savings. That's an interesting data point, but it is not necessarily as reliable as what we would prefer to use for the purposes of budgeting. And as you can tell, the savings accelerate through the years. Number one, because your costs are higher in the first year as you pay off the startup expenses. So we will be relatively conservative in our expectations of savings and hope to be pleasantly surprised.
Mr. France.
Thank you, Mr. Chair. So it sounds like the big risk is associated with if we're unable to incent employees to use it, correct? And then in terms of costs, it looks like $3 million a year for operational costs. So about $1.8 million just for the initial startup
Correct.
cost or so. Okay. And then what is it covered in this? Would it be because to keep costs that low when they're rising so dramatically, would that mean like certain specialists people would need to seek care? I know there was a list of what would be covered, but is there a particular category that's high risk, high cost that is it covered in there?
What we would see is the clinic will help better manage those with with chronic conditions. They will also manage their referrals, so they'll refer them out to a much tighter network.
Okay.
And not just use lower cost providers, but how do you politically correctly say, the better providers? So they will help manage those costs as well. Does that answer your
That
question?
does. Thank you.
Ms. Dabowski, any questions, ma'am?
No, any questions I have, I'll ask in person. I'm having a hard time hearing today for some reason.
I'm sorry, Amy.
That's okay.
Mr. Constant, sir.
Yeah, so, Mr. Abbott, you brought up an interesting perspective, and I was thinking of it right at the same time, and that's the question of not wanting to be pejorative of the potential vendor, but have we performed any investigation of stories of failures with VERA, or
Like
contracts
SAP?
that went sideways, and have any analysis of that?
I might ask, since we rely on the school district, and I know they've done extensive work with VERA and other proposers on their initial RFP, if Todd Hess, the Chief Human Resources Officer for the school district, or Dave Whiting, their purchasing official, might have information on that subject. So, Todd, Dave, would you be willing to comment?
We would appreciate it.
VERA has one clinic that was not successful, and in taking a look at that relationship, the vendor was not interested in engaging employees and trying to encourage them to participate. They wanted things done in a different manner than VERA has described and outlined in their proposal to the municipality and the school district. And so that clinic was not as successful. And as was pointed out earlier, the challenge, the unknown, the big unknown is encouraging employees to attend the clinic. And so there is a successful methodology that VERA has employed. The Kirkland example was utilized by Ms. Penny, and our research and our look at other clinics that VERA operates has verified that process as a methodology that is successful. Flagstaff is another area where the school district and the municipality jointly operate a VERA clinic, and that has also proved to be a successful operation.
Mr. Constant, anything else? Mr. Wilton?
We're paying for this on our agreement, so $850,000 is out of the medical and dental insurance. So we have a bunch of money. I mean, that's our self-funded pool of money, right? And then $1 million out of capital. So where does that actually come from?
No, all of the funding for this program will come from our, what we call the 603 fund, which is our self-insurance fund.
And what's this on? This is on 855 of our thing for Tuesday.
Mr. Wilson, the reason you see two different line items is because we have to account for the capital purchases in a capital account. So that money actually gets transferred from the 601 account to a capital account. It's an accounting process.
Okay, thanks.
Anything else, John?
No, that's good, thanks.
You said there was a nominal fee we're going to charge every employee when they go to a VERA facility. What's the nominal fee?
Mr. Trainee, the nominal fee is only for those who are on the qualifying high deductible health plan, and that's only for acute services. And VERA is doing a study right now on what that nominal fee, it's a fair market value, so we're trying to figure that out right now.
So we have no idea what the nominal fee is going to be?
Right now, I think they're looking at $75.
Okay.
And these are the plans, we call them health savings account plans. So these are the plans where you basically have, I'll call it high deductible or catastrophic health insurance, and then the muni, as the employer, gives you money in your health savings account that then you use to pay for health services. So we're giving $1,000 a year, or
150 months.
yeah, $150 a month, so $1,500 a year, or $1,800 a year, that essentially spends like cash as long as you're using it on health services, pharmaceuticals, doctor's visits. There's a few other types of expenses that are allowable, and that's what employees would be expected to use if they went to VERA instead of their regular doc, and they'd only use, say, $100 instead of what a regular doctor visit would otherwise cost.
Okay, thank you. How big is VERA? Are we talking, you said Flagstaff or some other place, how many sites does VERA operate now?
Great question. They have 7 current clinics, and they're adding another 7 throughout 2017.
Okay. Yes, Chris?
Yeah, so back to on this idea of the high deductibles versus the regular Blue Cross, Prima insured. I assume we have a lot of those, the non-high deductible, right?
I think of our 1,900 members, more than half are on, we call them the 500 and 1,000 plans. Those are the
Right.
deductible levels.
Right.
So we offer a 500, 1,000, and the HSA/high deductible plan.
Which is
So,
1,300.
with that in mind, then those people have insurance. They come to the clinic. Their insurance isn't billed, right?
Correct.
Correct.
Okay, so the people who have their families on those plans are paying for their families to be part of that plan, right? So in the 500 or the
You don't
1,000.
pay, families don't pay any more for the insurance than anybody else.
So they pay for it as well. It's not just something that the employee gets as a benefit. They actually have to pay into that, the 500 or the 1,000?
No. All of our employees, regardless of how many dependents they have, the employer, we have it down to the individual employee. That's how we charge our system. So the employee pays the same amount whether they have 5 kids or no kids. The employer pays the same amount whether they have 5 kids or no kids into our plan. That's how we have set it up. Some plans do it differently, and you know, spouse only, or spouse plus kids, or no spouse but kids, you name it. There's many different ways to do it. We have always done it this way. And everybody in the plan, dependent or spouse or employee, can use VERA the same way as everybody else. So, with the exception of if you're on the HSA system, where you would pay this, I think it's relatively small amount for acute care, you would be charged exactly the same way. And so a child whose parent is on the HSA plan pays the same as the employee that's on the HSA plan. And the same thing with the $500 or $1,000 plans. And they're all insured.
Right.
It's just a question of who pays what during the course of a year.
Any other questions, Chris?
Yeah, but I don't have it formulated well enough to ask.
Okay.
Thank you.
Anything else from the assembly? This work session over. Thanks for being here.